Greetings from Brookefield Hospital. I am Dr. Pradeep Kumar, critical care physician, senior consultant physician with interest in infectious diseases and cardiodiabetology. We are recording this video for awareness among general public and people related to voluntary services in the care of COVID-19 infections. Dear friends, we must consider the present state that we are going through as a medical emergency which has never hit our country in centuries together. The present situation is considered very critical and we need to take adequate measures to safeguard ourselves, our family and our near and dear ones. As part of this safety measures, it is highly recommended that the general public follow the government issued guidelines on a regular basis. All that is being told to general public towards social distancing has been advised after having taken into consideration the situations that we have gone through countries which have successfully overcome this by this policy of social distancing, and in countries which have failed to implement this social distancing. On one hand, we have Singapore as a country which has effectively implemented the social distancing, thereby keeping the infection rates under control, flattening the curve, what we mentioned regularly, and ensuring that people do not fall sick enough to need to get admitted to hospitals. On the other hand, we have countries like China, countries like Italy, countries like Iran, where they have failed to implement the social distancing as an effective policy. And that is the reason why we are seeing the immense catastrophe of higher number of people getting infected, higher number of people succumbing to this particular disease. So my humble request to each and every individual who is watching this video is to follow this principle of social distancing to the maximum effect possible. The reason why we need to implement this in an effective manner is because we do not have any other choice in the present condition. In the absence of social distancing, the price that we will pay for this illness is going to be immense. To give you an example, in countries which are more advanced, the most developed countries like the US, the situation is such that their healthcare system is crumbling because they are not able to provide the necessary amount of ICU and critical care for the so-called critically ill patients. There is shortage of doctors, there is shortage of personal protection equipments required for the healthcare workers, there is shortage of ventilators, there is shortage of ICU beds for people in a country like the United States of America and in the New York. If we have such scarce resources in such developed countries, imagine what could be the state of affairs in our country. To put things in perspective to the general public, we have Kerala on one side and the Bangalore and Karnataka on the other side. Kerala as such is a state where we have the highest density of population. As a result of this, social distancing is not being implemented effectively. And here you are seeing that the number of cases are increasing on a regular basis. In Bangalore, there has been a fair amount of success of social distancing, and hence we are able to keep these numbers under check. But there is a word of caution when we say that the numbers are low. The reason why I say that there is a word of caution is we are not doing testing to as many patients as possible. Patients are not patients unless they show up symptoms. But unfortunately, this infection has got a silent asymptomatic period where the persons can be carriers of these viruses, and they can also be spreading these disease unknowingly to people without their own knowledge. Hence, social distancing is the only tool that is available in our hands to keep this dreaded disease under check. My repeated request to the general public is to effectively follow this policy of social distancing, because once a person acquires this disease, there is very limited tools that are available as part of treatment. There is still not a single drug that has been proven in various clinical trials that has shown to be 100% efficacious to treat this particular disease. There has not been a single agent that has shown to be proven to be effective in prevention of disease. There has not been a vaccine that has been developed to prevent this disease. So, in the absence of an effective cure, in the absence of effective prevention by means of drugs, in the absence of effective vaccine against this disease, we have only this tool in our hand which we need to use effectively and forcefully if that needs to be implemented. The problem with our country is, in spite of the best available resources that we have, even in a best case scenario, this disease can infect approximately to the tune of almost around 25 to 30% of our Indian population. There is a wild guess that this particular disease can last anywhere in a best case scenario of 2 months to a worst case scenario of 6 months and above. Till such time where we do not have an effective vaccine, this is a dreaded period of time where we will have to ensure we effectively remain indoors and do not venture out unnecessarily. And I'm repeatedly giving this message to the audience that please remain indoors, please ensure social distancing as the only effective tool for our treatment. My humble request to all people is avoid going to public places, avoid visiting hospitals. Doctors are available online by way of online appointments, by WhatsApp consultations and various other mechanisms by way of telemedicine. So utilize these opportunities that are available and avoid venturing into hospitals unnecessarily if you do not have any compelling symptoms. My other request to the general public and for the treating doctors is, there has been unnecessary scare and deficiency of the hospitals with the doctors, nurses and the paramedical people who are the front end of providing care. They are at risk right now, and there is an acute scarcity of basic materials like the face mask, like hand sanitizers, gloves and personal protection devices. Imagine a scenario where your near and dear ones who are affected needs to be treated by doctors, putting their own life at risk without the presence of such basic material. So my humble request to all the public is, do not unnecessarily stock and consume these basic materials which are at a scarce for the hospitals and healthcare facilities. So please do not use up these materials unnecessarily and spare them for the healthcare workers who are at the forefront of treating this disease. The other message that I want to convey to all the general public is, since all of us are going through this critical phase, we need the support of the friends, family members and the general public. So avoid spreading fake messages, forwarding fake videos that are unauthenticated, think twice before you forward any such message or a media clip that you come across. Use any of these messages that you get. Use your discretion effectively so that you are not a person who is going to be responsible for promoting undue scare and panic in the general public. In the given context, as of today, people must be aware that we are close to 5 lakh infected public across the globe. We took close to almost 66 days to reach 1 lakh infected people. We took just 11 days to reach 2 lakhs people. We took just 4 days to reach 3 lakhs, and we just took 2 days to reach around 5 lakhs. Can you imagine the rate of spread of this particular infection? This infection does not spare anyone. It affects all age groups effectively. This is a new virus, so we do not have any immune protection for any one of us. This is a new virus that affects the elderly individuals with much more seriousness, and they succumb to these illnesses within a very short period of time. So all of us need to take precautions in following these basic etiquettes that we talked about. To repeat, social distancing, hand sanitization, wearing of face masks in appropriate situations, avoiding public gatherings, have good nutritious food, keep yourself hydrated, have enough warm liquid, consume natural food substances, avoid outside food consumption, keep yourself indoors, remain healthy, stay healthy, keep yourself safe. This is Dr. Pradeep Kumar, Medical Director from Brookefield Hospital, signing off. Reach out to me whenever you require any free consultation on our online. Thank you. God bless all of you.